just 1 second. طيب اليوم بدنا نحكي عن السيستميك كونكتيف تيشو ديزيز اللي هو few diseases. The main one would be systemic lupus erythematosus. Also, we'll be talking about systemic sclerosis, idiopathic inflammatory myopathies, polymyositis, and dermatomyositis, والmixed connective tissue disease. أول شيء systemic lupus erythematosus. طبعا هذا disease it's mainly an autoimmune disease. The criteria for the diagnosis of this disease, if the patient will meet these criteria, then he has systemic lupus erythematosus. If you already had the rheumatoid arthritis lecture, then it's not a similar disease, but it's the same situation, excuse me. فزيه زي rheumatoid arthritis. Criteria, if the patient will meet these criteria, then he has this disease. بالنسبة للأسلي, it's the most common multi-system connective tissue disease, so it's more common than other multi-system connective tissue disease. زي إيش؟ زي اللي حكينا عنه rheumatoid arthritis, زي مثلا بهجت disease اللي راح نحكي عنه بعدين. It's an autoimmune disease characterized by widespread inflammation and production of autoantibodies. المريض بصير عنده autoantibodies. This means wide spectrum of presentation زي ما راح نشوف. Peak age من 15 إلى 40 سنة. More women are affected than men. Also it has high prevalence بالblacks, بالAfrican Americans وبالUK. الفيتشرز الكلينيكال فيتشرز طبعا مش كل المرضى بصير عندهم these clinical features, عشان هيك في عنا كرايتيريا. لو ان كل المرضى بصير عندهم these clinical features كان it will be easy to diagnose these patients. الجنرال بصير عندهم fatigue تقريبا 80% من البيشنتس. بصير ممكن يصير في عندهم fever, weight loss, lymphadenopathy, though it's not that common. Arthralgia, arthritis combined with Raynaud's phenomenon اللي بتعرفوها وراح we will talk about it. Arthralgia or arthritis is the most common or are the most common presenting symptoms of this disease. Musculoskeletal features زي ما حكينا arthralgia or arthritis. Usually these are non-deforming arthritis involving 2 or more peripheral joints. بيصير عندهم also myalgia, mild morning stiffness, tenosynovitis, and avascular necrosis of femoral head. الارثروباثي تبعت اللوبس it's non-erosive arthritis, usually symmetrical, and may show diffuse soft tissue swelling, ulnar deviation, or orthotic deformity. بس هي الdeformities مش زي rheumatoid arthritis. These are the deformities of rheumatoid arthritis because of the destruction of the joints. This is because of the severe inflammation. Well, arthritis is non-deforming, يعني مجرد مراحل الانفلاميشن these might resolve. Mucocutaneous features بصير في عندهم mallar rash بس in 1/3 of patients. الissue mallar rash, it's erythematous butterfly rash over nasal bridge and malar bones and preserve nasolabial fold. ممكن يصير في عندهم alopecia which is diffuse and non-scarring, and they might develop libido reticularis and nail fold infarcts. A nail fold infarcts هي libido reticularis هون. هاي المالر راش 20 to 30% of patients. They might develop also photosensitivity, low reaction sunlight over sun-exposed areas, face and neck, and V-shaped area of the chest. ولس under the armpit. Also oral lesions, oral or nasopharyngeal ulceration, usually painless, erythema of the tongue, hard and soft palate, papules, vesicles, and petechiae. أيضا بين عندكم other skin manifestations بصير في عندهم I'm sorry, there is also discoid lupus developed in sun-exposed areas, hyperkeratosis with follicular plugging and scarring alopecia, erythematous hyperpigmented margins and flat scarred hypopigmented centers, or can be seen باللوبس and pure cutaneous lupus زي ما انتم شايفين اللي هي هاي. This is hyperpigmented areas and flat scarred hypopigmented areas. This is hypopigmented areas. These are hyperpigmented areas. This is the discoid lupus. The renal disease, low persistent proteinuria. The definition تبعه when do we call these patients as having renal disease؟ لما يكون عندهم persistent proteinuria more than 0.5 grams per day or greater than +3, abnormal CAS and impaired kidney function test. Lupus nephritis predicts the outcome. يعني renal disease, if the patient will develop renal disease, then it corresponds and predicts the outcome. إذا بصير عندهم renal disease, the life expectancy of these patients is less than those patients who do not have renal disease. عشان هيك you need to be very aggressive بالtreatment of renal disease. And you need to monitor urine analysis with blood pressure. Also, they might develop pleurisy with pleuritic chest pain with or without pleural effusion. This is the most common feature of acute pulmonary involvement with lupus. Pneumonitis, pulmonary embolism, pulmonary hypertension lung fibrosis. ممكن يصير عندهم alveolar hemorrhage اللي هو most dreadful with 50% mortality with treatment. طبعا ما فيش treatments all supported يعني ما فيش شيء to stop alveolar hemorrhage. If your patients will develop respiratory failure, then you need to put him on ventilator. Cardiovascular systemic lupus erythematosus. These might develop pericarditis, most common, myocarditis, Lehmann Sachs, endocarditis, aortitis, valvulitis, aortic insufficiency, accelerated atherosclerosis with 10 times higher mortality from MI from age and sex matched. Neuropsychiatric lupus, this is rare seizure or psychosis in the absence of offending drugs or metabolic derangement. Yani you need to be thorough to exclude other causes for this neuropsychiatric lupus. يعني مريضك مثلا ماشي على drug that might provoke lupus, seizure, then you blame the medication before you blame the lupus as the cause for this seizure. Wide range, طبعا manifestation wide range from headache to poor concentration to abnormal movements, chorea, transverse myelitis, acute confusional state, mononeuropathy, and lymphocytic meningitis. So all these might be presenting features of neuropsychiatric lupus. The hematological features ممكن يصير عندهم hemolytic anemia، ممكن يصير في عندهم leukopenia، lymphopenia and thrombocytopenia. Immunological criteria, anti-double-strand DNA antibodies in abnormal titers. This is specific lupus. Anti-Smith antibodies also, this is specific lupus. Or positive anti-phospholipid antibodies based on abnormal serum level of IgM or IgG, anticardiolipin antibodies, or positive test results for robust anticoagulants. So these are the immunological criteria: anti-double-strand DNA, anti-Smith, or anti-phospholipid antibodies. Anti-phospholipid antibody syndrome. These are anti-phospholipid antibodies. We call them anti-phospholipid antibodies. في عندك اللي هو anti-phospholipid antibody syndrome. which is like يعني syndrome غير عن اللوبس. This characterized by recurrent venous and arterial thrombosis, يعني unusual DVT and unusual deep arterial thrombosis and recurrent fetal loss أو recurrent fetal loss. يعني إذا مريضك عنده مثلا male recurrent venous and arterial thrombosis, female عندها DVT أو recurrent fetal loss, in addition to thrombocytopenia, prolonged PTT, lupus anticoagulant, cardiolipin antibodies positive, then this is antiphospholipid antibody syndrome. It can be primary or associated with lupus. طبعا we see this more بالفيميلز. يعني واحدة من هذول plus lupus anticoagulant. في عندك شيء بسموه drug induced lupus. يعني مريضك ماشي على you start him on hydralazine and then he developed the drug induced lupus, these symptoms اللي هو drug induced lupus, we call it drug induced lupus. طبعا it's common with procainamide, with hydralazine, also other medications like isoniazid and phenytoin. Renal and neurological involvement are rare. طبعا بصيرش في عندهم renal involvement. This disease characterized mainly by arthralgia, which is the most common symptom, malaise, low-grade fever, pericarditis, pleural involvement may be seen. يعني مريضك صار عنده symptoms suggestive of lupus after you start him on hydralazine or some kind of medication, then this is drug-induced lupus. شو اللابس اللي you might find بالأسهل anti-nuclear antibody طبعا in 99% of patients, but it is positive bil 5 to 10 to 10% of patient bil general population. Positive bil other autoimmune disease, so it's not specific lupus. Anti-DNA antibody 60% specific but not sensitive, increase with active disease. يعني مثلا مريضك صار عنده arthralgia or arthritis ويقول لك والله تعبان ومش قادر انام exhausted, then you order for him anti-DNA antibody. You may order complement. The complement C5, C6 will be low, while anti-DNA will be high. But don't follow the activity of the disease with anti-nuclear antibody, because this is not used to follow the activity of the disease or to diagnose a flare of lupus. عندك anti-Smith antibody 30% specific for SLE, and rheumatoid factor positive bil 40%. طبعا اللابس اللي هو also depends على الاورجن involved. يعني واحد عنده kidney involvement بصير في عنده abnormal kidney function test، بصير في عندهم leukopenia، ممكن يصير في عندهم anemia، hemolytic anemia، proteinuria, abnormal liver and kidney function test. Those C3 and C4 also this can be used to monitor the activity of the disease. Radiographs, some of the photos that we already saw. بصير في عندهم بالjoints periarticular osteopenia and soft tissue swelling. بالchest X-ray ممكن يصير في عندهم pleural effusion. طبعا بالjoint بصيرش في عندهم erosions. بصير في عندهم pericardial effusion, lung infiltrates, pulmonary embolism ممكن بالCT angiogram, interstitial lung disease or hemorrhage, and lung congestion from heart failure. يعني هم مريض عنده obliteration الcostophrenic angle اللي هو right pleural effusion، وهنا في عنده atelectasis اللي هي collapse of the alveoli. طبعا وين تشوفوا atelectasis اللي هو maybe the most common time you'll see atelectasis بال post-operative patient. يصير عشان هيك we use incentive spirometry. هاي الكرايتيريا تبعت اللوبس. You need to have 4 out of 11 in order to diagnose your patient with lupus. Mallar rash, discoid rash, photosensitivity حكينا عنهم, olar ulcers حكينا عنهم يعني less than I'm sorry, they are not painful arthritis, اللي هو non-erosive arthritis, اللي هو tenderness, swelling, or fusion involving 2 or more peripheral joints, serositis, pleuritis, chest pain, or pericarditis. طبعا هذول are more likely to develop premature coronary artery disease, renal disorder, persistent proteinuria, neurologic disorder, seizure or psychosis in the absence of offending drugs, hematologic disorder, immunologic disorder, and anti-nuclear antibodies, hematologic leukopenia, hemolytic anemia, lymphopenia, thrombocytopenia in the absence of offending drug, neurologic disorder, positive lupus erythematosus cell preparation, anti-DNA, anti-Smith, or false positive serological tests for syphilis. An abnormal titer of anti-nuclear antibody at any point in time, and in the absence of drugs known to be associated with a drug-induced lupus. The treatment of lupus, so you need to have 4 out of 11 in order to show us more, in order to diagnose these patients or this patient with lupus. طبعا التريتمنت لللوبس depend على الاورجن involved، يعني to my knowledge ما فيش والله drug involved I'm sorry يعني specific لللوبس you use it to treat lupus. It's the same as other autoimmune diseases. You treat على الاورجن, you treat the organ involved, you treat depends على morbidity and mortality, need team effort, you educate the patient and use NSAIDs. The steroids in high dose combined with cyclophosphamide بlife-threatening disease زي واحد صار عنده renal أو cerebral involvement. Use other immunosuppressive drugs زي azathioprine, methotrexate, cyclosporin in severe non-life-threatening disease, and foreskin and musculoskeletal involvement. Anti-malarial hydrochloroquine may be used. Long life warfarin for lupus patients with antiphospholipid antibody syndrome with history of previous thrombosis. يعني صار واحد عنده DVT because of lupus, because of antiphospholipid antibody syndrome, because the disease is there. Then you treat him with lifelong warfarin. طيب الستيرويد شو سايد افكتس تبعهم؟ اللي هو البون سكين ophthalmic cardiovascular hyperglycemia cardiovascular بصير في عندهم اثيروسكليروسيس وبالophthalmic بصير في عندهم كاتاراكت واللوكوما وممكن يصير في عندهم adrenal suppression وسبرس الاميونيتي. Cyclophosphamide suppress immunity. These patients they are more likely to develop infections. Cyclophosphamide بصير في عندهم myelosuppression, infertility and hemorrhagic cystitis. يعني اجاك واحد مريض مثلا بتوصل والله مريض ماشي على فوق سايكلو يعني مريض صار عنده هيماتوريا شو الدراج that he's on اللي هو cyclophosphamide. Hydroxychloroquine corneal deposits. Prognosis 5-year survival more than 90%, increased long-term risk of cardiovascular disease. طيب systemic sclerosis, also called scleroderma, it's a multi-system disease of unknown etiology. Pathogenesis include immune system activation, endothelial injury, and abnormal fibroblast activation. This results in small blood vessel narrowing and tissue fibrosis. It's a rare disease affecting 20 to 100,000 rare children, peak age between 30 and 40. More women are affected with family history with other autoimmune diseases, and no apparent racial predominance exists. السبتايبس تبعونه في عندك diffuse cutaneous systemic sclerosis DCSS, لما بيكون السكين انفولفمنت بروكسيمال للنيز والالبوز. وفي عندك اللي هو limited cutaneous systemic sclerosis skin involvement restricted to size distal to knees and elbows. يعني اللي هي common sense. Give me 1 second please. يعني ما هي common اللي عنده diffuse cutaneous systemic sclerosis اللي هو proximal للknees والelbows because the area is bigger than the area distal شو اسمه للknees والelbows. That's why we call this diffuse cutaneous systemic sclerosis and this one limited cutaneous systemic sclerosis. شو the clinical features؟ يعني when you start thinking about these about this patient having diffuse or limited cutaneous systemic sclerosis لما يكون في عنده Raynaud's phenomenon typical بصير في عندهم typical skin changes زي ما احنا نحكي esophageal gastric and small bowel dysfunction. إذا بصير في عندهم shortness of breath because of interstitial lung disease, pulmonary hypertension, renal crisis, interstitial lung disease, fibrosing alveolitis, mainly diffuse cutaneous systemic sclerosis. Limited cutaneous systemic sclerosis, they are more liable to develop hypertension. يعني diffuse cutaneous systemic sclerosis patient, they are more likely to develop interstitial lung disease. With limited, they are more likely to develop pulmonary hypertension. Renal crisis, malignant hypertension, and renal failure more diffuse cutaneous systemic sclerosis. Raynaud's phenomenon, اللي هو reversible skin color change. I think you know about it or you had it before. Peripheral digital ischemia due to vasospasm. يعني ممكن إذا كانت severe نوصل المريض يصير عنده digital ischemia induced by cold or emotion and maybe idiopathic. لما إذا كانت idiopathic we call it Raynaud's disease. لما تكون DU or associated with other diseases, we call it Raynaud's phenomenon. The causes the Raynaud's, occlusive arterial disease, thoracic outlet syndrome, and Berger's disease. These are other causes other than scleroderma, rheumatic disease, CREST, lupus, rheumatoid arthritis, myositis, repetitive vascular injury. ده واحد الاوكيبيشن تبعته involving vibration or leading to vibration of his hands. زي واحد working على compressor. Hyperviscosity and drug زي beta blockers. طبعا هاي polar phase. This is cyanotic phase. Other skin manifestations للسكليروديرما اللي هو peaked nose, burst mouth, microstomia, tight thick skin. بتصير في عندهم salt and pepper pigmentation, hyperpigmented areas surrounded by hypopigmentation اللي هو زي كأنك راش عليه ملح وفلفل. Skin changes, ulceration of the tip of the finger, secondary to ischemia. بتصير في عندهم thickened dark skin over fingers as a result of self-amputation of the distal phalanx due to anemia, flexion or contractures of the fingers are present. Esophageal dysmotility, يعني زي ما انتم شايفين esophageal dysmotility صار عنده. Heartburn and reflux symptoms. Sorry, this is barium enema. Barium swallow, causing or showing dilated esophagus. Difficulty in swallowing solid foods can be followed by difficulty swallowing liquids. Dilated esophagus on esophagogram. So this is esophagogram اللي هو so barium swallow. بصير في عندهم dilated esophagus. When do you order? When يعني إذا واحد عنده this motility disorder of the esophagus. When you order another time you order esophagogram ده مريضك مثلا شفت عنده pneumomediastinum, if you are thinking about esophageal rupture, then you can order esophagogram. This is يعني مداخلة side note. Interstitial lung disease, pulmonary fibrosis, ground glass obesities, interstitial lung disease, اللي more commonly diffuse cutaneous systemic sclerosis. renal crisis والhypertension scleroderma. طبعا إذا مريضك عنده hypertension وعنده scleroderma, you have to treat him with ACE inhibitor. ما فيش another medication you may use. Yeah, طبعا of course you may use other medication, but the first line medication اللي هو ACE inhibitor. Major complication, early in disease first few years, acute onset hypertension, renal impairment, renal failure can be reversible if blood pressure treated. الدرug of choice اللي هو ACE inhibitor. CRISS syndrome اللي هو calcinosis, Raynaud, esophageal dysmotility, sclerodactyly and telangiectasia. هاي الكالسينوسيس بصير في عندهم mainly بالفingers. This is the calcinosis زي ما انتم شايفين بصير يعني deposits للكالسيوم عنده. والسكليروداكتيلي skin changes, friction contractures. هاي سكليروداكتيلي because of the tight skin. telangiectasia هاي على وجهها. والإزوفيجيال ديسموتيليتي اللي حكينا عنها قبل شوي. الكلينيكال فيتشرز. This is when you يعني إذا مريضك عنده هاي الفيتشرز you diagnose him with شو اسمه سكليروديرما. ما فيش كرايتيريا زي اللوبس. anti nuclear antibody positive بال 90%. anti topoisomerase 1 antibody بيكون positive اللي هو SCL اللي هي سكليروديرما 70 ب 30% بالديفيوز cutaneous systemic sclerosis. والانتي سنترومير antibody positive in 60 to 70% of CRISS وبالليميتد cutaneous systemic sclerosis. So الSLE SCL 70 30% بالديفيوز cutaneous systemic sclerosis والليميتد cutaneous systemic sclerosis اللي هو الانتي سنترومير antibody. Treatment is no effective treatment. 60% improve with time. Treat hypertension. Calcium channel blockers may be helpful بالرينود. Avoid cold exposure. طبعا إذا مريضك على drug then you take him off that medication and discontinue it. For severe digital ischemia, epoprostenol may help treat interstitial lung disease and pulmonary hypertension. يعني مريضك بده أكسجين ماشي على أكسجين. Corticosteroids and cytotoxic drugs for patients with myositis and alveolitis. Prognosis, 5-year survival 70%. Poor prognostic factors اللي هو old age, diffuse cutaneous systemic sclerosis, proteinuria, high ESR, low CO diffusion. طبعا this means that your patient has interstitial lung disease and pulmonary hypertension. Idiopathic inflammatory myopathies. في عندك these are group of autoimmune diseases characterized by symmetrical proximal muscle weakness and non-suppurative inflammation. Extramuscular features في عندك pulmonary interstitial pneumonitis and fibrosis, carditis, SVT, cardiomyopathy, heart failure, pericarditis. Systemic features زي fever, weight loss and fatigue. Classification: adult polymyositis, adult dermatomyositis, polymyositis, dermatomyositis associated with malignancy, childhood dermatomyositis, polymyositis, dermatomyositis associated with other connective tissue disease, including body myositis. So we'll clarify the thing. Epidemiology اللي هو rare disease. It has bimodal peak من 10 ل 15 من 45 ل 60. Women are affected 2 times as men. The malignancy associated with myositis may common after, more common after the age of 50. Lowest reported in Japanese and highest in African American. طبعا الكلينيكال فيتشرز شو بصير في عندهم؟ بروكسيمال ماسل ويكنس. هسه واحد عنده كانسر، let's say واحد عنده lung cancer ولا colon cancer and he's coming to you telling you that والله انا يا دكتور عندي يعني صعوبه، صار عندي صعوبه بلع وعندي وشويه ماسل ويك مش قادر احرك ايدي ودائما متعب ومرهق. عملت له سي كي، طلع سي كي elevated. This is dermatomyositis associated with malignancy. اوكي. واحد عنده مثلا لسه عمره 15 سنه واجاك the same symptoms. This is childhood dermatomyositis or polymyositis. واحد عنده لوبس. بس احنا حكينا اي شيء بلوبس مثلا انه كوز مايوسايتس وانكريز بالسي كي is unlikely. فاذا اجاك مع هاي symptoms this is مثلا dermatomyositis associated with connective tissue disease. So this is the way we diagnose these the thing. Anyhow, فبصير في عندهم proximal muscle weakness، بصير في عندهم dysphagia, arthralgia, myalgia, skin rash. So you need to be minded when you start thinking about these diseases. طبعا بالديرماتومايوسايتس احنا حكينا بوليمايوسايتس لما يكون بالمسلز، الديرماتومايوسايتس لما يكون في عندك سكين involvement. فواحد this is skin involvement. واحد عنده هوليوتروب rash which is villaceous discoloration of eyelid with periorbital edema. This is dermatomyositis by definition. ما فيش عنده مثلا skin rash، ما فيش عنده skin involvement، ما فيش عنده telangiectasia، ما فيش عنده Gauthrin's papules اللي هي silver scaly rash over extensor surfaces of proximal and distal interpharyngeal joints. This is اللي هو Gauthrin's papules. ما فيش عنده photosensitivity او عنده photosensitivity. So يعني لما يكون في عندك اللي هو skin involvement or skin manifestation this is dermatomyositis. لما يكون في عندك no skin involvement polymyositis. لما يكون associated with malignancy for example dermatomyositis associated with malignancy. ما فيش عنده malignancy، ما فيش عنده other association then it is primary dermatomyositis. لما يكون في عندك shoal distribution اللي هو الفوتوسنسيتيف راش بالشول ديستريبيوشن. الديفرنشال diagnosis طبعا this is الديفرنشال diagnosis اللي هو hypo or hyperthyroidism, HIV infection, muscular dystrophy, myasthenia gravis. واحد بيشرب الكحول كثير، ماشي على ستاتين لانه بتعمل لك مايوسايتس، واحد ماشي على كولشيسين، والكونكتيف تيشو ديزيز زي اللوبس والروماتويد ارثرايتس. باللابس اللي هو elevated creatinine kinase يساره CRP elevation only in 50%. والauto antibodies that might be positive anti-nuclear myositis specific antibodies and anti-synthetase antibodies. The criteria diagnosis: proximal muscular weakness, elevated muscle enzymes, myopathies, changes by EMG, muscle inflammation on biopsy, and skin rash with dermatomyositis. طبعا he has to اللي هو واحد عنده proximal طبعا he has to have proximal muscle weakness and this is when we call it myositis. ولما يكون في عنده it's myositis اللي هو inflammation of the muscles. That's why you need to have elevation بالmuscle enzymes because it's inflammation بده يكون في عنده abnormalities بالEMG وإذا بدك تعمل له biopsy بيكون في عنده اللي هو muscle inflammation. So these are the criteria. أنا when I said no criteria I meant يعني ما فيش عندك والله إنه something يعني you have to be minded، مش والله إنه 3 out of 6 or 5 out of 10. طبعا هاي كلها لها علاقة بالمايوسايتس اللي هو بيكون في عنده طبعا he has to have symptoms then when you start thinking about myositis and then it's inflammation. عشان هيك بده يكون في عنده abnormal EMG، بده يكون في عنده elevation بالسي كي اللي هو بالسي كي. واذا بتعمل له بايوبسي بده يكون في abnormal biopsy because it's inflammation. يعني بشوف مثلا white blood cell count invading the muscles and all these things. اذا صار في عندك skin involvement اللي هو بصير في عندك dermatomyositis. The treatment almost زي lupus you need to use steroids. إذا كان في عندك oral manifestation immunosuppressive steroids conserving like methotrexate azathioprine. زي واحد صار عنده مثلا interstitial lung disease then you need to be aggressive with treatment. IV immunoglobulin for steroid resistant cases of polymyositis. بس هي يعني بالinpatient يعني واحد صار عنده flare بتستخدم له IV immunoglobulin والفيزيكال ثيرابي اند ريهابيليتيشن. اخر شيء اللي هو الميكس كونكتيف تيشو ديزيز. هذول المرضى بيكون في عندهم overlapping clinical features of systemic lupus erythematosus, scleroderma and myositis. Most patients have antibody against ribonucleoprotein RNP. clinical features يعني لو اجاك مثلا واحد عنده كذا 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 يعني clinical picture of mixed connective tissue disease, which antibody you will pick اللي هو ribonucleoprotein. طبعا clinical features بصير في عندهم some features of free node, swollen hands اللي هو arthralgia, myositis, swollen hands يعني زي rheumatoid arthritis, myositis, atherosclerosis, esophageal dysmotility, lung fibrosis and pulmonary hypertension. So these are some features. الله يعطيكم العافية. حدا عنده سؤال؟ طيب خلينا نبدأ another meeting. We'll go for dyslipidemia. خلينا ننهي الميتنج هذا وبعدين إن شاء الله